Okay, chapter 32, section 3, rickettsial diseases. Now we need to keep in mind rickettsia are a group of small bacteria that are strict intracellular invertebrates. Okay, so these are intracellular pathogens. They are going to be spread animal to animal, insect to human, human to another insect, animal to some mammal, back to an insect coming in for, another blood meal, or different insect coming in for a blood meal. We associate these with the bloodsuckers, ticks, fleas, mosquitoes. Three groups. We group them loosely into three groups. That's based on the type of disease: typhus, spotted fevers, and ehrlichiosis. Now this typhus here, do not confuse this with typhoid. Okay, typhoid is the diarrheal bacterial disease. Typhus here is an arthropod spread bacterial infection of the blood. Rickettsias, we cannot culture them in lab. Okay, if I was to give you a vial of rickettsias, whatever bacterial species we group with the rickettsias, you would not be able to go into 211 and grow them in a petri dish. Doesn't matter which type of agar you use or whatever, goes back to this intracellular aspect. Intracellular in a tick, intracellular in the mammal host. So, we use laboratory animals, mice, rats, whatever. Use other ticks, lice, to sit there and see what their life is like inside the arthropod host. We have had some luck with mammalian tissue culture. So you isolate human or dog or whatever type of cells, and you grow them in tissue culture in a flask. We've had some luck doing that, as well as in chicken eggs that have been, fertilized. So there's a chicken embryo. What we find is, for many of those that we consider to be rickettsia, phagocytes, the macrophages, the neutrophils, the monocytes, that seems to be the intracellular host of choice. So let's look at the typhus group. Rickettsia prowazekii, transmitted by a louse. They go in for a bite. Well, they're carrying them, on them, in them, and it's spread the feces. You go in, you scratch, or the feces gets down into the bite when they're done feeding. Rickettsia exits that and enters into the wound, open wound, and then you end up with bacteremia. Complications of this, damage to the central nervous system, lungs, kidney, heart. Because they're in the blood, they're going everywhere. They're infecting, they're damaging. High mortality rate, depending upon where you're at in the world, that has typhus, about 30%. Here in the US, I believe it's a bit lower because of what we have medical-wise. If you're going to be in an area of the world where typhus is endemic, there is a vaccine that they will give you that will reduce the chances, not completely get rid of the chances of you getting sick, but reduce the chances of you getting sick. And if you do get sick, it's going to reduce the symptoms and any potential complications from the symptoms. The spotted fever, and it gets its name, spotted fever, because you're going to have a rash, head to toe and everywhere in between. This is going to be Rickettsia rickettsii. Transmitted by dog and wood ticks. So, you like to go out walking in the woods. One of the things they always tell you when you go out walking in the woods, when you get home, check yourself for freckles. Hey, I got a new freckle. Wait a minute, that freckle's moving. It's a tick. About 2,000 people acquire spotted fever every year. Seems, we get this big push over the past few decades to get back out into the wilderness. Increase in people wanting to go hiking and things like that. You want to do trailblazing. Read somewhere, some of it could also be people wanting to do geocaching, whatever, you know what I'm talking about. So they're out traipsing in places that are not normally part of, their domain, so they're not dressed correctly. They don't take the correct, precautions by spraying on, insect repellent. They go traipsing in the woods looking for the cache, and hey, guess what? They find the cache, they get the little doodad, they leave a doodad, and they pick up a few riders. Yeah, ticks, the moving freckles. What we see is that Rickettsia rickettsii grow in the nucleus and cytoplasm of those immune cells and some epithelial cells. Symptoms include headache, fever, rash. So, Rocky Mountain spotted fever is what we're talking about here with Rickettsia rickettsii. You're going to see certain areas. It's not just the Rocky Mountains. People ask me again, why do they keep calling it Rocky Mountains if it's not, the major numbers aren't the Rocky Mountains? Because that's where they first found it. It does happen there, but it's in low numbers. Seems to be more here. Us, Arkansas, Tennessee, Virginia. When you go and you look in the textbook, you look at the pictures, you see grows in the cytoplasm. The bacteria is in the cytoplasm, so it's inside the cells that should be clearing it out. We can culture it in the lab. Here it's a stained slide of chicken yolk, chicken eggs. Got to remember the chicken yolk and the developing embryo are full of cells. And that's a perfect place for the Rickettsia rickettsii to grow. And you look to the far right there, just above my head, and that's the spotted fever. Typhus, the difference between typhus and Rocky Mountain spotted fever is the severity. How spread are the spots? Typhus is going to be mostly, if I remember correctly, face, neck, trunk, whereas Rocky Mountain spotted fever, it's literally head to toe and every place in between. Another of the rickettsial diseases is what is known as ehrlichiosis. Ehrlichiosis by Ehrlichia schaffensis. What we see here are what are called emerging diseases. We're starting to see more and more of this. This isn't something we normally see or we don't have a long history with. So they call it emerging disease. Human granulocytic anaplasmosis and human monocytic ehrlichiosis. Basically, two sets of your blood cells are getting infected by Ehrlichia, and, well, they're not surviving, and our immune system, our bodies, have not evolved to have cellular contents just disgorged in your blood in great numbers, because then the rest of your body kind of goes haywire, and that's what we're seeing here. Flu-like symptoms: fever, headache, malaise, leukopenia, meaning your white blood cell numbers are going way off, and the thrombocytopenia, your platelet numbers nosedive. If somebody starts to show these symptoms, basically you want to get them into the hospital very quickly because they need to stabilize. Antibiotic treatment is very successful. Okay, antibiotics get in, kill the bacteria, and given a few days of hospital arrest with, supportive care, basically getting fluids in, maybe even getting them some blood, some plasma, or whatever, their body will, recover. As with all these, avoid the host. Use the insect repellents. Keep the fleas, the ticks, and whatever off of you. And then finally, the last rickettsial we're going to talk about is called Q fever. Q is for query. Okay, this is due to Coxiella burnetii. Coxiella burnetii is another intracellular pathogen. Yes, it can survive outside of a cell for a while, but it is at home and it is happy inside of one of your cells. Coxiella burnetii, we get this one. It's not an insect bite or arthropod bite per se. We are exposed via contaminated products, wool, meat. You are rubbing on the wool. Gets into small fissures, cuts, whatever gets into your skin is able to get in and spread. You're going and you're sacrificing, you're chopping up meat. Chances are you may have a cut, scrape somewhere on your hands, gets in that way. Not sure, I'm pretty sure you don't get this one from eating meat. I think it's just the handling of. Tetracycline still works. Tetracycline is great at taking care of this. They're looking at this one as a potential bioweapon. Because if it gets in and, you're not going to kill a lot of people, but if you can cause a lot of people to come down with pneumonia, because it gets into their blood, it gets into their, they're breathing it in because they're handling the wool or they're, slaughtering meat, chopping meat. Well, you don't have to kill the army if you can make enough of them sick, and the other half, the rest of the army that's not sick has taken care of the sick ones. So if they're too busy to fight, you've automatically won.